Good morning, all. My topic is complication of LA. So, local complications of LA. Local complications of LA include needle breakage, prolonged anesthesia, facial nerve paralysis, ocular complications, trismus, soft tissue injury, hematoma, pain on injection, burning on injection, infection, edema, sloughing of tissue, and post-anesthetic intraoral lesions. So first of all, needle breakage is very rare complication, and the cause of needle breakage is used to intentional bending of the needle by the doctor before injection or due to a sudden unexpected movement by the patient while the needle is still embedded in the tissue or due to the forceful contact with bone. And the problem is it causes serious damage on the soft tissue and surrounding structures. And the management include, first of all, access to a hemostat enable the doctor or the assistant to grasp the needle fragment and immediate referral of the patient to an appropriate specialist for evaluation and possible attempt to retrieval. Locate the retained fragment through panoramic and CT or 3D CT scanning. Remove the retained needle fragment with the patient under general anesthesia. And the prevention of this needle breakage is do not use short needle for inferior alveolar nerve block in adults or in older children. Do not use 30 gauge needle for inferior alveolar nerve block in adult or children. Do not bend the needle when inserting them into the soft tissue. Do not insert a needle into the soft tissue to its hub unless it is absolutely essential for the success of the injection. Extra caution when inserting the needle in younger and immature children or in extremely phobic adult or children. Next is prolonged anesthesia or paresthesia. Paresthesia means feeling numb for many hours or days after a local anesthetic injection. And the definition of paresthesia is defined as persistent anesthesia or altered sensation well beyond the expected duration of anesthesia. And the causes is trauma to any nerve, local anesthetic solution contaminated by alcohol or sterilization solution, and hemorrhage or edema. And the problem of paresthesia is it causes soft tissue injury, biting, thermal or chemical insult, and a sense of taste may also be impaired. And the prevention is strict adherence to the injection protocol and proper care and handling of dental cartridge. And the management is resolved within approximately 8 weeks without treatment. First of all, reassure the patient and record the details of the patient and then examine the patient and send the patient for a second opinion to an oral surgeon. Then reschedule the patient for examination every 2 months for as long as the sensory deficit persists. Then if it is not corrected, you can go for surgical repair. Next is facial nerve paralysis. It occurs when local anesthesia is introduced into the deep lobe of parotid gland through which terminal portion of the facial nerve extract. And the cause is introduction of local anesthetic into the capsule of parotid gland, which is located in the posterior border of the mandibular ramus, and which is clothed by the medial pterygoid and masseter muscle. And the problem is it causes loss of motor function to the muscles of facial expression, and there will be cosmetic problems, wrinkling and blinking become impossible. Prevention, adhere to the correct protocol. Management, reassure the patient. Contact lens should be removed until muscular movement returns. Eye patch, if present, contact lens, if present, should be removed and eye patch should be applied to the affected eye until muscle tone returns. Record the incident in the patient record. Then ocular complication. Next is ocular complication. The cause of ocular complication is diffusion of anesthesia drug through myofascial spaces or bony opening. Inadvertent intraarterial injection of the local anesthesia is another cause, and another cause is inadvertent intravenous injection of local anesthetics. Then it can also cause due to direct trauma. Some of the ocular complications include amaurosis, blindness, diplopia, endophthalmosis, globe penetration, Horner syndrome, then impaired visual acuity, mydriasis, ophthalmoplegia, ptosis, and strabismus. And the management is, first of all, reassure the patient. Eye patch should be placed and ask the patient to consult an ophthalmologist. Next is trismus. Trismus means lockjaw. That is, it is defined as prolonged tetanic spasm of the jaw muscle by which the normal opening of the mouth is restricted. And the causes is trauma to muscle or blood vessels in the intratemporal fossa, or contaminated LA solution, or hemorrhage, infection, or excessive volume of LA. And the problem is there is hematoma. It causes chronic hypomobility, and that can lead to subsequent fibrosis and may lead to scar contracture. And another cause is infection. If there is infection, patient may experience pain, and it can lead to hypomobility, which causes increased tissue reaction or irritation, and that can lead to scarring. And the prevention is use a sharp, sterile, disposable needle, proper care and handling of dental local cartridges, use an aseptic technique. Contaminated needle should be changed immediately, and a traumatic injection technique should be followed. Avoid repeated injection or multiple insertion into the same area. Use regional nerve block instead of local infiltration. Use minimum effective volume of local anesthetic solution. And the management is, you can go for heat therapy, warm saline rinse. If there is pain, you can give analgesics and muscle relaxant. Then physiotherapy, that is opening and closing of the mouth as well as lateral excursion of the mandible for 5 minutes every 3 to 4 hours. Then chewing gum can be used. Avoid further dental treatment in the involved region until symptoms resolve. Then soft tissue injury. Soft tissue injury is a self-inflicted trauma to the lip and tongue and is frequently caused by the patient inadvertently biting off or chewing this tissue while the patient is anesthetized. And the cause is, it is most commonly seen in younger children and in mentally or physically disabled children and in older patients. And the problem is it can lead to swelling and significant pain. Prevention is local anesthetic of appropriate duration should be used. A cotton roll can be placed for isolation if there is anesthesia is still present. And self-adherent warning sticker may be used for children. Management is analgesics and antibiotics can be used. Lukewarm saline rinse can be used, and the petroleum jelly can be applied for lubrication. And hematoma. Hematoma means the effusion of blood into the extravascular space and can be caused by inadvertent nicking of blood vessels during administration of local anesthetics. And the cause is arterial or venous puncture after posterior superior alveolar nerve block or inferior alveolar nerve block. Then hematoma that can occur after inferior alveolar nerve block are usually seen intraorally, whereas hematoma due to posterior superior alveolar nerve block injection are seen extraorally. And the problem, this hematoma can lead to trismus and pain. And the prevention is, PSA nerve block is the most common cause for this hematoma. Then comes the inferior alveolar nerve block. So modify the injection technique according to the anatomy of the patient. Use a short needle for PSA nerve block and minimize the number of needle penetration into the tissue. Never use needle as a prop. And the management, immediate management is direct pressure for a minimum of 2 minutes should be used to the site of bleeding. Then inferior alveolar nerve block, if the hematoma is due to inferior alveolar nerve block, then you can apply pressure to the medial aspect of the mandibular ramus. And then if the hematoma is due to infraorbital nerve block, then you can apply pressure directly over the infraorbital foramen. And if it is due to incisive nerve block or mental nerve block, directly apply pressure over the mental foramen. And if it is due to buccal nerve block, you can give a pressure at the site of bleeding. Then posterior superior alveolar nobula, it is difficult to apply pressure to the site of bleeding. The bleeding normally ceases when the extravascular pressure exceeds the internal pressure or when the clotting occurs. Digital pressure can be applied to the soft tissue in the mucobuccal fold as far distally as can be tolerated by the patient. Ice should be applied to increase the pressure on the site and help to constrict the punctured vessel. Then another complication is pain on injection, and the causes is careless injection technique and multiple insertion or rapid deposition of local anesthetic solution, or if needle is used as barbs. And the problem is causes increase if the patient is anxious, causes sudden unexpected movement, and it causes the increased risk of needle breakage, and that can lead to traumatic soft tissue injury to the patient, and that also causes needle stick injury to the administrator. And the prevention is adhered to correct protocol. Use sharp needle, use topical anesthetic properly before injection, use sterile local anesthetic solution, inject local anesthetic slowly, the temperature of the solution should be correct, and buffer the local anesthetic solution. No management is needed. The pain will reduce after injection. Burning on injection. The causes is pH of the solution and rapid injection and contamination of the solution. And the problem is can lead to cross-anesthetic trismus, edema, and paresthesia. And the prevention, buffering of the local anesthetic solution and slowing the speed of injection. Management is transient and do not lead to prolonged tissue involvement, and the treatment is not indicated. Post-injection discomfort, edema, or paresthesia can be managed according to the problem. Infection is very rare, and the cause is contamination of needle and improper injection technique and improper tissue penetration. Problem can lead to infection and trismus. Prevention, use sterile disposable needle, and proper care and handling of the needle should be done. Take precaution to avoid contamination of the needle, avoid multiple injections, then proper care and handling of local anesthetic cartridge, and properly prepare the tissue before penetration. Management is heat and analgesics, muscle relaxant, physiotherapy, and antibiotic therapy. Edema is another reason. The cause is trauma during injection, infection, allergy, hemorrhage, injection of irritation solution, and hereditary. And the problem can lead to airway obstruction. And the prevention is proper care and handling of anesthetic solution. Use a traumatic injection technique. Complete and adequate medical evaluation should be taken whether the patient is allergic to any drug. Management, infection. If there is infection, you can give antibiotic therapy, and you can, for allergy, you can give oral histamine blocker. If the patient is severely allergic, you can, and if the patient is unconscious, first place the patient in supine position, then check for the circulation, airway, and breathing. BLS if needed, then definitive care, you can give epinephrine or histamine blocker is administered intramuscularly or intravenously. If respiration is not proper, you can give corticosteroid intramuscularly or intravenously, or you can go for cricothyrotomy. Sloughing of tissue, and it is due to the prolonged irritation of or ischemia of gingival soft tissue, and the causes is epithelial desquamation and sterile abscess. If there is epithelial desquamation, you can apply topical analgesics, and if there is sterile abscess, the sterile abscess usually develop in the hard tissue due to secondary to the prolonged ischemia resulting from the use of local anesthetic with vasoconstrictor, and this can lead to pain. And the prevention is you can give topical analgesics, and the management, if there is pain, analgesics can be given, or topically you can apply aura base, that is triamcinolone ointment can be applied. Then another complication is post-anesthetic intraoral lesion, and the cause is recurrent after stomatitis or herpes simplex. And the problem, mild burning or itching sensation will be present. Prevention can give antiviral drugs, that is acyclovir 4 times daily. And the management, no management is needed. If there is pain, you can give topical analgesics and a mixture of diphenhydramine and milk of magnesia or oral base or tannic acid can be applied. Thank you.